And then coming up towards the area with more cartilage, I see a bit of veinage there. Nothing that appears distended. Cherry angiomas, I don't think they're anything of concern, but I would just like to make sure. So just going to... Looks okay. And then looking over this area of the nose. And as I come down towards the lashes, I'm just going to have a very gentle look here. And I'm just going to have a look at the brows. And you have a fair amount of new growth around the temporal region, which is always a good sign. So far that actually feels okay. Just going to gently apply this to the area. Helps soothe some of that external irritation. Right about there, so we're kind of centered. The scapula. Alright, Halle. Thank you so much for coming into the office today. I have you in for a bit of a dedicated skin inspection. We're going to go over a few different things. So it is your first time in the office. I haven't assessed you at all just yet. So from what I was reading, it looks like you kind of want to do an overall wellness exam, kind of have a look at the state of your skin, see if there's anything that we could maybe make some improvements in. I also saw a note about some concerns with the scalp, so we'll also do a bit of a scalp check. Have a look at your hair, and then just kind of upper body and back focused, okay?
Okay.
Is there anything really specific that you wanted me to look at today as far as like skin texture or any blemishes, anything like that? Any mole concerns?
I'm currently kind of breaking out on my chin.
Breaking out on your chin, okay. Is that fairly abnormal for you?
No.
Okay.
Unfortunately.
Okay, so we will go ahead and have a look at that. I'll see if there's anything specific there that I think we can maybe, fix, or if there's any underlying conditions that could be causing the breakouts, and we'll kind of go from there. So what I typically like to do is start with just an overall visual inspection. So I'm going to just kind of have a look at the state of your skin as a whole, so you can just go ahead and relax for me. I'm going to begin by just having an external inspection here, so just kind of looking over the overall area. I do like to start kind of arms and upper chest as well as face and neck, so also looking at your hair color. So as far as I can tell, skin tone is fairly even. I would say that your arms are maybe very slightly tanned compared to your chest and face. Do you typically wear sunscreen?
Yes.
Okay, so sunscreen is very important, especially this time of year. And let's see. I do notice a couple freckles and moles here and there. Overall skin complexion is nice and clear. I don't notice really any areas of discoloration. Maybe some slight blemishing of the chin is noted. Your hair is very fair in color. Is this your natural hair color?
Kind of.
Okay.
I just got highlights.
Okay, so mostly natural base, maybe just a couple highlights here and there. Okay, so scalp color is consistent as well. Eyelashes are very full, nice and long. Okay. So I'm going to go in with my pen light. It is going to be a little bit bright, so I will ask you to close your eyes. Don't want to shine it directly in your eyes for now, okay? So I'm just going to come a little bit closer here. I'm going to have a look with my pen light. So just shining it over the skin, looking for any areas of concern. I do see a couple moles, so really just looking to see if there's anything that jumps out at me. Chest wall is nice and clear. I don't notice any wrinkling or any areas that look particularly dehydrated. Skin actually does appear very plump, very well moisturized. Would you say that you are fairly well hydrated? You drink a lot of water?
I try to, yeah.
Good, okay. So water intake and hydration can definitely affect the health of the skin. I don't notice any creping. No signs of fine lines. Not something I would really expect to see for your age range, but just always good to have a look. Just having a look over the nose, looking for any signs of excess clogging of the pores. Just gonna shine right over your eyes. Just keep your eyes closed for me. Your eyelashes are very, very long, nice and full, very even as well. I don't notice any sparseness. Same with your eyebrows, particularly looking for any sparseness at the tail, which is also not notable there. I do have a couple cherry angiomas, which are totally benign. And then as I have a brief look over the hair texture is very, very soft. No areas that appear brittle or dry. Nice and consistent throughout. No areas of excess breakage as far as I can tell. I will do a couple tests for strength and integrity of the follicle as well as scalp health, but so far externally that actually does look very good. And brief initial inspection at scalp color looks good as well. Nice and consistent with forehead color. How many hours a day would you say you're exposed to direct sunlight, Halle?
Gosh, maybe like 20 minutes.
20 minutes, okay, so not very often where you're just outside in the sun.
No, I was really just walking to it.
Okay. No, see. Good. So even those days I would still recommend wearing sunscreen. So oftentimes we don't think about kind of indirect sun exposure, so depending on your commute time, when you're in the car, even if you're at work sitting in front of a window at your desk, all of that does count as UV exposure, so just something to keep in mind. Just adjust my gloves here. Apologize for the ambulance. My office is fairly close to the emergency department. Go in with a bit of a physical inspection now. So I have gloves on. I'm going to come in and start palpating around your face, kind of upper chest wall, as well as along the scalp, okay? So at this point, there's nothing specific you need to do. You are welcome to tell me if any of this causes you any discomfort, if any areas feel particularly tender or painful. So I'm going to start with some more kind of soft, gentle surface level palpation. At this point I'm feeling more so for overall texture of the skin. Feeling along the forehead. Overall skin texture here is nice and smooth. Feeling directly between the brows where we tend to kind of get first onset of fine lines, which again is not notable here. You have several cherry angiomas here, which is fairly common in fairer skin. I don't notice any areas of sparseness. no signs of traction damage or traction alopecia. Do you typically wear your hair down or up, or a combination of both?
Combination of both. Okay.
So I don't notice any pulling here, which would indicate prolonged periods of having your hair in a tight ponytail or tight bun. And just have a look at the brows. Very nice and full at the brow, pretty symmetric, and hair evenly distributed there. Eyelids are nice and clear. Don't notice any excess veinage, discoloration there. And as I come down towards the cheeks, we're still nice and full, very healthy buccal fat distribution here, nice and plump at the cheeks. Just coming down, having a look at the nose. I don't notice any signs of excess congestion. So I'm going to have a little bit of a closer look at that in just a second. As I come down towards your lips and chin area, I do see a little bit of that more active acne that you were talking about. So it really just kind of depends on lifestyle. It does appear as if your blemishes are kind of isolated to the lower chin area, which can sometimes indicate hormonal imbalance. So that may be something to keep in mind. Otherwise, it could be product specific. Have you changed your skincare routine recently?
No, but I was diagnosed with endometriosis.
Okay. So any blemishes of kind of the lower third of the face do tend to be related to hormonal imbalance, specifically in women. So it's definitely something to keep in mind. Sometimes dietary changes as well can affect that. So just palpating here at the neck area, feeling for any signs of inflammation. Don't notice anything so far. Skin overall is just very nice and smooth. And then have a look at the upper arm area and shoulders. Again, just a few freckles, some moles here and there. Do you have a different skincare routine for nighttime versus daytime, or is it about the same? Okay. Lips as well are nice and hydrated, very pink, no signs of any paleness or cracking there as well. Alright, so I'm going to come in with a magnified tool. This is just going to allow me to have a bit of a deeper inspection at some more troubled areas. So, Halle, I'm going to have you turn your face here just slightly for me. Is that comfortable for you?
Yes.
Okay. So I'm going to come in a little bit closer here. I do want to just have a look at some of these cherry angiomas. I don't think they're anything of concern, but I would just like to make sure. So just going to have a look here. Looks okay. And then looking over this area of the nose, you see just a little bit of discoloration there. It actually looks more like irritation than it does look like a blemish. Maybe just a mild abrasion there. And just adjust my magnification. So now having a look at the chin. Okay. So this does appear to me more in the lines of hormonal acne for sure. Okay. Don't want to irritate the area too much. Just we'll assess that a little bit further. Okay. So I'm going to do just a bit of a deeper palpation here. Because it is close to the area near your nose, I'm just going to do a slightly more moderate palpation, looking for any signs of inflammation. Have you had any illnesses recently?
I did have a cold like a month and a half ago.
Okay. Just feeling for any residual inflammation of the lymph nodes. So far, not notable there. Any pain or swelling of the throat? Also just going to feel along the thyroid, feeling for any signs of asymmetry there. Okay. Nice and mobile. I don't feel any rigidity there. Okay. So let's give your skin a second to breathe. I'm just going to have a look here at the hair a little bit further. So, just have these tools here, just little metal sticks. I'm just going to use these to separate a few areas of the scalp and actually just move your hair back. A beautiful wavy texture to your hair. So I'm just going to come in and visualize a couple areas. I like to pay specific attention to the hairline. Look for any signs of damage. Any flaking. Do you ever have any issues with dandruff?
I don't really know.
So your hair itself is very clean. It does appear well maintained. I don't see any excess oil. Doesn't appear greasy. Also, on the other side of that, it's not overly dry. Nice and bouncy. There's no stiffness. Do you typically part your hair down the middle?
Yes.
Okay. So I do see a pretty formed part. It does appear as if you typically part your hair here. So I am just going to have a look there. I like to look at the part. Again, sometimes tend to get some excess sun exposure, so I just want to make sure there's no signs of damage there, as we're obviously not usually applying sunscreen to the scalp. So don't see anything notable here. Color is consistent. No signs of redness or flaking or anything. You do have one mole here, right about where you part your hair. It is pink in color. I would say fairly symmetric, maybe slightly asymmetric at the tail end, closer to the hairline. And it is raised above the surface of the skin about 1 to 1.5 millimeters there. Okay, so maybe just something to keep an eye on. Color is consistent though, so it's not anything particularly concerning. As I come further into the hair, I'm just going to have a look here, closer to the crown. Okay. Going to feel for the integrity of the hair itself. So you're going to feel some light kind of taut pulling. It shouldn't cause you any pain. I'm just testing for any signs of protein deficiency. No notable abnormal gumminess or abnormal stretching of the hair itself, so that's a good sign. I'm going to do some very light tugging at the hairline here, Halle. Let me know if this is painful at all. I'm just testing the overall integrity of the hair follicles, so looking for any excess shedding or weakening breakage of the hair directly along the hairline. So far it's not noticeable. Healthy follicles should be able to endure a decent amount of tugging here, so that actually looks okay. Right. And then as far as the ends of your hair, I don't notice any brittleness or excess breakage there. Hair actually appears very soft. Ends are fairly blunt, indicating a recent haircut. So that's very good. Alright. So continuing with your scalp exam, I have a scratcher tool here from Pretty Feelings, and this is just going to allow me to very gently scratch along the scalp, feeling for any lumps or bumps, anything that feels particularly abnormal. The scalp is fairly smooth, so if I feel any lumping, could be a cause for concern. So far not being met with anything rigid. I don't feel anything laterally. I'm just going to feel horizontally here as well, down towards the ears. Sometimes get a little bit of inflammatory buildup there. Do you ever have issues with headaches or migraines?
I wouldn't say so, no.
Okay. So far that actually feels okay. So I'm going to use my tweezers. Just going to inspect this section here along the hairline. Again, one last test for that integrity of the follicle. So just a very, very gentle tugging motion here. I do have a fair amount of new growth around the temporal region, which is always a good sign. I would say hairline is fairly symmetric from either side. Alright, so I'm going to come back into the face, and I want to just have a better look here at the brows and lashes. So excuse me as I just come a little bit closer to your face. Just going to very gently manipulate the brow hair. So it's really just assessing for any breakage or dislodgement of hairs upon manipulation. So far it is not notable. Looks very healthy, so inner corner of the brow starts off fairly symmetrically at the outer corners of the nose bridge, and then as we come towards the tail, they also end at the same place as well. And as I come down towards the lashes, I'm just going to have a very gentle look here. It appears if you have on some mascara, but I don't notice any normality of the lashes. I'm just gonna have a quick peek here. I don't notice any signs of mites or any notable signs of infestation of the lashes or the brows. No irritation near the lash line as well. Alright. Okay, so I'm going to perform a couple percussions here. Just be careful not to pull your hair. So just to give you an example, you're going to feel me come in with my hammer here, and I'm going to do some very gentle percussing around the different quadrants of your face. So splitting your face visually into 4 sections here, kind of middle of the forehead down to the nose, over towards your left eye, stopping at about the ear. Same for the right side, and then for the lower half, it's lower cheek, down towards your chin and jawline. Same for the right side. So I will start here at the forehead, some very gentle percussion, testing mostly for abnormal surface indentation, any signs of dehydration. Specifically like to feel around the cheek area. Very nice and reactive there. Testing for symmetry here and bilateral response. Coming, of course, along the right cheek as well. And very gently along the tip of the nose. As I come down towards the lower left quadrant, I'm going to feel specifically along the jawline and the upper neck area. So we do tend to neglect our neck and chest when it comes to skincare. I typically recommend to follow your skincare routine down the neck and chest if you can, as well as the back of the hand if you're concerned with any dryness, specifically with your nighttime skincare routine. Just percussing along the chin, being careful around these more inflamed areas. I just want to feel anything here, but so far that actually looks okay. So I'm going to briefly come down at the chest wall. When you apply sunscreen, do you typically apply it to the neck and chest as well?
Sometimes.
Sometimes, okay.
So if I know I'm going to be outside.
Okay. Too bad, it still appears fairly well hydrated. Same at the shoulder. Maybe some slight pinkening here. It's not noticeable on the other side. Okay. So I'm going to come in now with this device. It's been setting up for a minute here. So you're going to feel kind of a cool sensation along your skin. So just to give you an example, it feels just a little bit cold. I'm going to gently set this on different areas of your face, and it's going to allow me to read for any areas of inflammation or any issues kind of below the surface of the skin. So this uses tiny electric pulses uses kind of ultrasonic waves to read for any areas of concern, and it will alert me if there's anything that needs a little bit more attention. So I'm just going to move along different sections here, and I can see on my screen if there's anything concerning. So far everything looks okay. Moisture levels are reading as normal. Slightly drier there. Okay, so there's one mild indication there towards lower left mandibular joint. If we come on the other side, I do sometimes see inflammation near the temporal region, but for you that does look okay. Moisture levels at the cheek are well intact. There's no indication there. Okay, so again, as I come down towards that lower mandibular joint and test for bilateral symmetry, there's a little bit of dryness just directly underneath the chin. Mild markers of inflammation there. I'm just going to come up here just below the lower lip. So I'm just reading overall mildly inflamed at the chin. It's not, anything that's emergent or overly concerning, but I am picking up some signs of inflammation. So, do you notice that changes, or that it gets better or worse depending on your diet? Things sometimes like processed foods or foods high in sugar sometimes can.
Honestly, it's just all over the place these days.
Okay, so just kind of touch and go.
Yeah, like with my cycle.
Yeah. Okay. You feel like it's definitely worse when you're getting closer to your menstrual cycle?
Yeah, but weirdly, I've been breaking out after.
Okay. So that can be normal because your body is trying to re-regulate, especially with endometriosis. Your hormones are kind of fluctuating abnormally throughout the month, and then once you have your cycle, your body is trying to kind of balance out and sometimes can overcompensate a little bit. So that does make sense. Do you apply anything topically as far as like acne medication or?
Yeah,
Okay. Do you feel like that works really well for you?
I don't know anymore.
Okay. So something to keep in mind if you have been using the same, medicated ointment for quite some time, your skin can kind of become accustomed to it and almost a little bit immune. So then sometimes we would recommend switching products. Obviously with skincare, it's not recommended that you switch back and forth fairly frequently, and it does take a little bit longer than people think for you to see if your skin is adapting well. So when you switch to a new product, I usually recommend that you only switch one of your skincare products at a time. That way you're noticing if there's any adverse reaction, you can tell that it's, likely the one product that you switched. And then we recommend using it for a minimum of 3 weeks before you can tell whether or not there's a difference. So about 21 days. Sometimes we tend to use a product for, 3-4 days and think, well, it's not making that much of a difference, but your skin might just have not had enough time to adjust. So
I feel like it helps with my acne scarring.
yeah, it can for sure. It can help with a little bit of that melasma and discoloration. There's also a really good adapalene gel by La Roche. If you're familiar with La Roche-Posay, that's another one that I recommend fairly frequently. Nothing overly drying though, so I wouldn't recommend any of those kind of powder mix potions where you apply and it really dries out the area, because that tends to just cause more of an issue. Your skin is fairly well hydrated. You could even do something like a cold therapy. So just to give you an example, I have these ice globes here that are really good at helping with inflammation. So we typically keep them in the freezer. And if you have any areas that are particularly painful, we just kind of gently apply them to the area and help reduce any of that external inflammation. really good to use in the morning, even around your lower eye area if you have any puffiness when you wake up, things like that. So just gonna gently apply this to the area. Helps soothe some of that external irritation. Obviously, you always want to work with clean hands, clean tools. And for you, I would recommend starting your skincare obviously at the top of the face and then working down towards any of the more problem areas, just so you're not spreading any bacteria. So I'm going to come in with these little silicone caps. Just kind of soft silicone texture. This is just going to allow me to very, very gently pull at the skin. Just assessing for any concerns with skin texture. So you do have just a very mild patch of kind of pink here, which is right between the brow. Just gonna have a quick look here. Okay, looks okay. Could also just be irritation from me manipulating at the skin, so that's okay. So I'm gonna do a bit of a firmer motion here, just along the gum line, pushing up the fat distribution of the cheeks. So I'm going to come down now and just have a look at the chest wall. I want to do a little bit of stretching at the skin, assessing skin turnover. Do you typically apply lotion out of the shower? Upper body, just to see if there are any differences, but I actually think that looks pretty good. Your skin is really well hydrated. I do want to just have a look at this area here. Just kind of mildly inflamed at the shoulder. Halle, I'm going to have you puff out your cheeks for me. So mouth closed and just bring a little bit of air into the cheeks. I'm just going to do a quick test here. Any signs of weakening, but that looks okay. Alright, you go ahead and relax there. Thank you. Just a little bit of a flake test here. Test for some irritation. Alright. Okay. And there are no areas of the skin or upper body where you feel any tingling or numbness, nothing that feels particularly abnormal or hypersensitive. No. Okay. Alright. And as I touch your face here, I want you to just tell me if it feels about the same on both sides. So the pressure here, does that feel about equal for you? Just below the brows, does that feel about the same? Yes. And here, is that about the same?
Yes.
below the eyes there, that's about the same.
Yes.
And as I come along lower face, is that about the same?
Yes.
And no differences along the chin, that all feels the same. Okay, good. Very good. Just making sure that the external inflammation isn't caused by any nerve damage. Usually looks pretty good. Okay, so at this point, Halle, I do want you to go ahead and turn around for me. I want to have a look at kind of the upper back area, as well as the reverse side of your scalp and around the nape of your neck. Okay? All right. So coming in to have a look at your back. Do the same thing and start with a bit of a visual inspection. Just having a look with my light for any areas of concern. You do have some red marks that are obviously just from the bed. That's totally fine. So you do have several moles notable. I will have a closer look at those and make sure that there are none that look particularly suspicious. So when we look at moles, we look for symmetry in shape, so typically round or circular, oval in shape. Look for any ridges, whether or not they are raised above the surface of the skin like this one, or flat against the skin like this one. Also look for any abnormalities in color, so consistency in color, whether they're brown or more flesh toned, pink or red. You do have some more cherry angiomas at the back. Most of these look okay. This one does have a smaller dark mark there. Just going to use that same tool here to read for any inflammation there as well. I know that's cold, I apologize. And since I have this out, I will go ahead and trace along the back for any markers of inflammation. I'll start kind of spanning the shoulders. This will also notify me of any areas that are particularly tense. So far that looks okay. So we're just going to come directly along the spine. Maybe some mild inflammation being noted at the shoulder. Do you have any tensions of the upper shoulder? Okay, okay. Let's continue with my inspection. I'm going to have a look more at back of the neck. Don't notice any redness there. Nice and consistent in color. I'm going to move into some palpations, just like I did with the other side. I'm just going to feel around, feeling particularly at the base of the skull, nape of neck. Nothing at the back of the cranium either. And as I palpate along the back, feeling along the musculature, as well as superficially at the surface of the skin. Very gently along the spine, and I don't want to compress too much. I'm just feeling for any signs of inflammation here. back in with those same silicone tips and just gently graze the skin. This is more so assessing for skin texture. So it allows me to feel for any kind of abnormal texture, any areas that aren't as smooth. Just a little bit there. Overall skin texture is fairly smooth. I do maybe just feel a little bit of dehydration at the center back. Slightly dry, but nothing too concerning. Just a little bit less moisture retention here. Okay. Just feeling along a couple areas. That actually looks pretty good. So I just have a tool here that's going to produce a very kind of gentle puff of air. You might not even feel it. I'm just testing for any dislodgement of skin cells or release of any debris on the surface of the skin. Just a little bit there. So center back is where I'm noting most. Just a little bit of dryness, nothing. Same tool I used earlier. I'm just going to come in with already feeling scratcher. I just want to feel again for any abnormal lumps, bumps. Just going to bring that down onto the back. Just very gentle pressure. I don't want to scratch the skin. I'm really just feeling for any abnormality and consistency of skin texture. Also good to show for any signs of inflammation or irritation. Just very linear movement here. Notice just about a pattern here, directly parallel to the spine. Just going to test that bilaterally here. So you're going to feel cold sensation. And I'm just going to test quickly for any differences parallel here. Make sure that one side isn't reacting differently. Actually looks okay. Right about there, so we're kind of centered the scapula. Just maybe a little bit here as well. Okay. I did just want to check a couple sections at the back of the scalp and make sure I didn't miss anything. Very consistent in color and texture. I don't notice any abnormalities here either. So just gonna do a couple of those same percussions here. Just a little bit of tightness there at the shoulder. Fairly common, specifically if you tend to work at a desk a lot. We tend to hunch our shoulders, so that's not, anything that I would say is abnormal. So I just want to continue palpating, just percussing gently along. Any sense of inflammation along the scalp. I think lastly, I'm going to come up and do just have a look here and make sure sometimes I might have missed something, so I just want to have a look along the ear since the area is exposed. Feel briefly around the back of the ear, sometimes see markers of inflammation here. Nothing here. Do a bit of a skin inspection. I do see what looks to be a piercing. Appears to have healed well. I don't notice any inflammation of the lobe. And then coming up towards the area with more cartilage, I see a bit of veinage there. Nothing that appears distended. External ear canal is nice and clear. I don't notice any signs of debris. Just going to look briefly A little bit of pinkening at the top of the ear. Overall color is consistent. Also just going to just again checking for any dislodgement or signs of excess debris, but I don't notice anything. Alright, Halle, so as a whole, I would say your skin infection was fairly well within normal limits. I would actually like to have you back for a more in-depth assessment of some of these moles. I think we can do for a full dermatology assessment where we take some measurements and photos and make sure that there are none of these that need to be biopsied, but I do think it would help to have them documented. So I can have Rachel get you scheduled for that up at the front desk. Otherwise, I would say as a whole, your skin exam was fairly normal. I do have some mild concerns of hormonal acne along that lower chin line as we discussed earlier, so I do have some recommendations that I can send over for that as well. In the meantime, you're welcome to take your time getting ready, and I appreciate you for coming in today. Thank you so much, and I hope you